Hello, everybody. Nelson Virgil here with ExcelMale.com and DiscountedLabs.com. I'm very honored to have Dr. Roy today. She's in Boca Raton, Florida. We're becoming close friends in the past few months. Very progressive physician, treats men and women for all kinds of issues related to aging and sexual dysfunction and erectile dysfunction and fatigue, etc. So why don't we start, Dr. Roy, by having you give the audience a little bit of a background on your work.
Sure. Thanks first for having me. I really appreciate the opportunity to speak to your audience. I know that it's a group that is looking for some help, and hopefully I can provide some great information. So I am a functionally trained physician, and what that means is that I'm trained to look for the root cause of problems. You can learn about functional medicine by going to functionalmedicine.org. It's sort of the new medicine, if you will. It's what everybody wants. Everybody knows that there's a reason why they're experiencing the symptom of erectile dysfunction or sexual dysfunction in general, or low energy or low libido. And quite frequently in a traditional medicine approach, we're just prescribing medications, or we're looking at some cursory lab saying, oh, well, there's nothing wrong with you, Nelson. I don't know why you're feeling the way you are. It must be in your head. You must be depressed, something like that. So that's where functional medicine was born several decades ago. So I am functionally trained. So every time I encounter a patient with a problem, my brain immediately goes to work thinking about what might be the cause of this problem. And I think that's the biggest difference in what it is that functional medicine provides. So I've been practicing functional medicine for 13 years. It's the only medicine I've ever practiced, and I have become very passionate about helping men and women with their sexual function because it's fascinating to me, and there's always an underlying reason. It's almost a crusade that I'm on to help men in particular understand that erectile function changes, decreases in ejaculate volume, decreases in libido. These are all, even Peyronie's disease, these are all symptoms of an underlying challenge. And it's so multifaceted that I find it just incredibly fascinating.
Yeah, I think most doctors used to see, they just test for testosterone, and that's it. They write your script. They don't do the actual workup, the real comprehensive testing that is required. So why don't you tell us a little bit about what would you do, for instance, if I was a new patient walking in with symptoms of erectile dysfunction and fatigue and just not being cognitively, not being all the way there.
Yeah.
So tell us a little bit of what that functional integrative approach is.
Absolutely. So the patients that come through my door are looking for that expanded evaluation. And of course, I have all of the tools to treat sexual dysfunction as well, all the exciting regenerative tools. But the evaluation to me is foundational. I do a very, very complete blood panel. And when I say that, I've got a list of just the highlighted areas that I test routinely. Everybody, doesn't matter what you come in with. We take a look under the hood, if you will. I'm looking at a cholesterol screening, which everyone's had done. I'm looking at an advanced lipoprotein particle evaluation. So what that is looking at what really does the cholesterol mean. Do you have inflamed cholesterol that could be causing you a problem? Is your good cholesterol actually protective? So we have to answer those questions. I look at sterol absorption. Sterol is what that's called, absorption and synthesis markers. So how is it that you're metabolizing your cholesterol? That gives me some ideas about, where the dysfunction is. Not all cholesterol needs to be treated, and certainly not all cholesterol needs to be treated with a statin medication. I look at inflammatory and oxidation markers, many of them, not only in the blood, but in the urine. Got some great advanced testing. I look at the entire endothelial function evaluation. So I'm looking at how does the inside of the blood vessel actually work? Are you getting that vasodilation that we all know is so necessary for erectile function, for cognitive function even? So if you have poor blood flow to the penis, you might actually even have poor blood flow to the brain. You might actually even be someone who's at high risk for developing cognitive decline. I look at genetic markers that actually can tell me what sort of risk you're at for cognitive decline. And it's also associated with telling me what kind of foods you should eat, what sort of fats you should eat. There's an awful lot to it. I look at methylation markers and methylation genetics, which is a very important biochemical process. I certainly look at hormones, but the entire spectrum of hormones. So pituitary hormones are the signals from your brain effectively working to stimulate the endocrine glands to produce. When we're talking about sex hormones, it's important to understand your adrenal function. So cortisol, DHEA. It's also important for men to know what their estradiol and estrone are like. I mean, a lot of times I'll see patients who have had lots of blood work over the years, and there isn't a single estradiol on the chart, and that can make all the difference. Or prolactin. Prolactin is so important to sexual function. That is routinely tested. I also look at autoantibodies because so many of us have autoimmune processes brewing that we don't realize that are very easily detected. And so that's necessary to address. A complete cardiometabolic evaluation. So not only looking at fasting blood sugar, which by the way is the last thing to change on the whole continuum to diabetes. If your doctor tells you you're pre-diabetic, guess what? This has been brewing for about 10 or 15 years. So I want to know 10 or 15 years ahead of time so I can help you change that trajectory. So I'm looking at fasting insulin. I'm looking at different pancreas markers to see if there's some pancreatic stress. There's even autoantibodies against the pancreas that you can check quite easily. I'm looking at a complete metabolic panel, but I'm reading it a different way. So everybody has a CMP on their chart, but I've caught a lot of calciums that are above 9.6. The range, and this is very interesting, and I wanted to talk about this to help your audience understand the importance of calcium and an elevated calcium. It doesn't have to be elevated outside what the lab range is in order for it to be elevated. That's probably the single most important thing that I can tell your audience, and that is when I'm reading the blood work, I'm not looking for H's and L's. I'm not looking for that. I'm looking for optimal ranges. I'm looking at optimal ratios, your estrogen to testosterone ratio, perhaps. With regard to calcium, any serum calcium that's above 9.6 for an adult, even though most lab ranges go up to 10.5, that is suspicious. So I look at a parathyroid hormone, and I actually diagnose a lot of hyperparathyroid disease where you never actually see an H next to the calcium. Yet it's a silent killer, and it is a major cause of erectile dysfunction that people don't realize.
Oh, really?
So, yeah. There was, I'll provide to you after we finish with this interview a paper that the Norman Center out of Tampa, Florida just published. It's the only paper like this, and it's a very large population that they tested that show subtle elevations of calcium being so damaging to the body. I am looking at your PSA, but I also do a free PSA and that total free ratio, which is so important. And I also look at omega-3 and 6 fatty acid index. So it's a complete evaluation of what is happening at a global cellular level to help me with my intervention. So you may certainly have hormone imbalance, and I could correct that hormone imbalance. It doesn't mean that it's going to change your erectile function. It's only a player. I need to look at your inflammatory status. I often will need to intervene from a nutritional perspective. And it's not even a judgment against the food, junk food versus healthy food. It's how is your body receiving this food? And how about how do your genetics dictate how you should eat? There's a lot to it. And so it's a full investigation of what might be happening. The other thing that I do across the board is a coronary calcium score, which is a CAT scan of the chest looking at the coronary arteries. And I want to tell you how this works because I've saved several men's life just in the last 12 months. And these are guys that actually have cardiologists on their team. But a lot of times in a traditional medicine setting, the doctor is very, they're challenged by the system, and well-meaning, but challenged by the system. I don't work in that system. So I have a relationship with my patient, not your insurance company. So that doesn't cloud my brain at all with my decision-making. And I say that just to not to be accusing traditional physicians of not doing their job, but just that there's so much more opportunity to take better care of patients. And a coronary calcium score is one of them. Simple, non-invasive test. The way this works is inflammation is the precursor to all disease. And it's hard for people to understand what that really means. So that may be a different conversation on a different day. But as the body has inflammation, the response quite frequently is a breakdown in the endothelial function, that single cell layer inside the vessel. So not only does that affect the dilation and blood flow, but also the body reacts by creating cholesterol to try to patch and bring integrity to that vessel wall. Then your body will calcify the cholesterol plaque in order to stabilize it. So that's where we have an opportunity with a simple CAT scan to see how much calcium is built up in those coronary arteries. And that will give us a very sensitive evaluation of whether you have cardiovascular disease or not. Just a quick story. I had a couple of competitive athletes in my practice this year. They challenge their heart every day with just what it is that they do. They both had cardiologists on their team because they both had some family history of cardiovascular disease. They had echocardiograms and stress tests and all of these things that didn't show any disease at all. When I did this simple coronary calcium score, they showed significant plaque buildup. One of their cardiologist really didn't want to do much about it. So I'm on the sideline. I thought, okay, I guess the cardiologist in control here. But this gentleman went on to develop atrial fibrillation a couple of months later, and then actually started to have some chest pressure. Ended up having a catheterization. Sure enough, that coronary calcium score was exactly dead on. And he had a 90% occlusion in the LAD, which is considered the widowmaker. And so we saved his life because he's an athlete, and many of the guys in your audience are. You're creating all kinds of collateral circulation as a result of your hard exercise, which is wonderful. But if that LAD were to close, guess what? That collateral circulation wouldn't necessarily save your life. And so a simple test like a coronary calcium score is very telling. If you have calcium buildup in the coronary arteries, then it's likely that you have calcium buildup affecting the arterial flow into the penis. I do a duplex Doppler ultrasound on all the guys as well.
Oh, really? That's what most doctors don't do that. So
I love it. I had a gentleman come in the other day for a consultation, and I talked to him about doing a complete evaluation. He had a Peyronie's that developed post-trauma, and he's 62 years old. So I said, we should really do full panel of blood work. We should do a coronary calcium score. We should do a Doppler ultrasound. He said, okay, that sounds great, but I'm going to see my urologist this afternoon, and then I'll get back to you. Because if I can have my urologist do my Doppler, I'll do it, and that works.
And tell people what the Doppler is about and where you actually do it.
I will. I'll definitely do this. Yeah. So anyway, went to his urologist, and the urologist said, you don't need that. Interesting. You don't need that. So what the Doppler does is tells me exactly what's happening in your penis. If you have it, I can see the arterial blood flow in, I can see the venous flow out, I can assess any sort of fibrosis. A lot of guys don't realize they'll have extensive fibrosis.
Yeah.
That's a problem. So what we do is we look at the penis in the flaccid state to evaluate that baseline, and then we inject a trimix, a bimix, some vasodilating medication. I know a lot of your audience is familiar with those medications, to then assess how much responsiveness we actually get when we induce that type of vasodilation. So we're able to look at the ratio or the change in blood flow from a flaccid state to an erect state, or at least a partially erect state. No need to get a full erection to do the evaluation. And then we're able to also look to see if maybe the maintenance, the erection maintenance problem is in fact a venous leakage. And we can quantify it. If there's a plaque or some fibrosis that is present, we're able to look at the extent of the fibrosis. And so it gives us a real objective measure of what's happening in the penis. And then that helps us understand the extent of the treatment that might be necessary.
So as a patient, when I hear this, my first question to my mind is, wow, this must be for rich people,
Yeah.
not only rich people, but rich people that live in Boca Raton, Florida. So tell us what the whole process entails. It's a lot more testing than most of us are used to be honest with you.
Yeah.
I'm looking forward to going to see your clinic. I already met you obviously in your clinic, but actually being a patient. So
Yeah.
I think I really looking forward to a baseline evaluation like that. I've never had one, never.
Good. Yeah.
So I'll be your test subject. Maybe I can even report on that. But tell us how you get this blood work test paid for. You don't have to be specific on the cash outlay, but for those of us that may not be obviously rich, but are concerned, or is there a way to do monthly payments? How do you set up your patients?
Well, let me just start by saying we spend our money in ways that are important to us. And people have to take responsibility for their health and wellness and decide to invest in their health and wellness. So this is an investment, okay? We'll make no bones about that. You do not have to be Boca Raton wealthy to afford this type of thing. We spend crazy money on crazy things, okay? But it is certainly an investment. I'll just tell you, so for this full evaluation, it's about $4,000. Now, if you have insurance, it's about $4,000. If you don't have insurance, it's about $4,000. Okay, I try to do my best to negotiate prices with labs and get this thing covered. But for the most part, I can do it for about $4,000. And it is really, in my mind, the best $4,000 that you can spend, because I am giving you a full evaluation of your health and wellness. And as I said, saving lives just by looking a bit deeper. When you have insurance, it helps me because I have less outlay of cash, okay, and we can do a few more things. When you don't have insurance, then there's a cash pay. These labs are not that expensive when you negotiate, when the physician negotiates a price, and I just pass that along. I like to bundle things because I don't want to nickel and dime. I don't want to have to fill in here or there. This is how I do it, and this is how I like to do it. Now, if somebody comes in and says, I don't want to do a full evaluation, I want to just do the Doppler. Fine, it's $500. Do I recommend a full evaluation? Yes, but one of my strengths and part of my magic is that I meet people where they are. I just meet people where they are. My heart is in this to try to help people get their life back on track because I understand how difficult let's just talk about erectile dysfunction. I understand how difficult that is and how life-changing it is to have erectile dysfunction. Now, I'm also interested in what's caused that problem, because it sucks for your family if you die, also of a heart attack, right? So when men come in, they're focused on their erections, and understandably, but I'm focused behind the scenes of what caused that erection. So it's about $4,000 to have that full workup with the coronary calcium score and the Doppler and the blood work and the interpretation, which takes time and expertise. We'll sit together for an hour and a half and go through all of this data because I want you to understand what's happening here. Then we build a treatment protocol that includes diet changes when diet changes are necessary, that focuses in on the inflammation if the inflammation is problematic. You could be loaded with inflammation and yet not have any plaque buildup in the coronary arteries at all. In my mind, all that means is it buys us some time. We still have to address this inflammation because it's causing problems elsewhere and potentially going to lead you down, a pathway to disease, because inflammation is the precursor to all disease. Now, the treatments that I have here range from nutritional therapy, supplement support that's targeting the endothelium, also brain chemistry, right? Because an erection actually starts in the brain, and you can have low dopamine.
Yep.
That could be your issue. You could have an endothelial problem. That could be your issue. You could have a hormone imbalance. There's an awful lot to it. You may have a virus that is affecting your energy and your ability to perform, or even your ability to have a good desire. So the treatment strategy really is based on the evaluation. What is, I think, challenging in our culture is we're all looking for a quick fix. Now, the good news is I have some quick fixes too. So things like platelet-rich plasma, shockwave therapy, these are all Band-Aids, but they're wonderful Band-Aids, meaning they are part of, not just Band-Aids, let me back up on that. They're part of a quick fix. They really are. They are regenerative. They work when they're applied appropriately. And just because somebody has a shockwave machine doesn't mean they're applying it appropriately. And I'm going to warn your audience, shockwave is the hottest thing that's happened to urology, and I am so excited about it. But with anything in our culture, we have a bunch of thieves out there. We have some manufacturers that are coming up with machines that aren't strong enough. This is just happening now. It's not strong enough to create the kind of cellular change that you need to get your erections back on board. So just like anything else, you're going to spend thousands of dollars for a treatment that's called shockwave therapy, or thousands of dollars for a PRP treatment, and they may not be spinning the right kind of PRP. I mean, I could talk about this all day long. There is science that supports what are the settings, how much energy needs to go in. Is it a focal shockwave? There's so much to it that you have to either do the research yourself and then ask before you go and give your money to a center, or go to somebody that you trust who understands these things. Same thing with PRP. I speak internationally on platelet-rich plasma, and I can't even tell you how many physicians who have been doing PRP for years have no idea about what kind of PRP they're spinning, what are the cellular constituents, why you would want to get your concentrations in the right, why you'd want granulocytes or not want granulocytes. They don't understand the science. It doesn't mean they're hurting anybody. Nobody's getting hurt, but you're not necessarily getting an effective treatment. You're not getting the most efficient efficacy. So there's a lot to it. So the treatment strategy, if you will, is really based on that underlying evaluation. When we do hormone therapy, there's lots of ways of doing hormone therapy. There's no wrong way, but you've got to really pay attention to monitoring all of the different things involved, like prolactin, like estradiol, like a hemoglobin and a hematocrit, and make sure that you keep guys safe. I've had guys come in here, their testosterone looks absolutely beautiful, but nobody's looked at their estradiol and prolactin. And those are the things that are off. Once you dial that in, now they're feeling those effects of the testosterone therapy.
Yeah, and I think I'd definitely like to invite you to come back just to talk about PRP and talk about shockwave
Uh,
and all the other stuff that my audience may not be very familiar with for sure, because I think I'm going to get a lot of questions after I post
I
this.
would imagine, yeah.
So, but I just wanted to keep it kind of a short intro on what you do. People can, what's the best way for people to contact you or your clinic?
I think the best way is to go to my website at this particular moment. I do a lot of different things here, and that website is always changing. But you can take a good look at just in general what it is that I have. At least at the last website update, things are changing so fast. It's exciting, and phone numbers are there, and I'm happy to get on the phone and just chat more.
Yeah, and what's the name of the website?
doctorsstudio.com, all spelled out. You could
Okay.
search my name also, Lisbeth Roy. I've done a lot of different videos that people seem to enjoy watching. They're really educational. I'm not trying to sell anybody anything in particular. Really, to me, the educated patient is just the best patient because they understand, quality, and they understand that it can be a pretty complex problem, but we can always fix it. And that's the exciting part of what's happening today is we can fix it. We've got regenerative things happening in lots of great ways.
And for out-of-towners like me, I live in Houston. How many visits do you think, face-to-face visits, will be required for you to work with me?
Yeah, that's a great question. So about 50% of my patients do not live in Florida. And about 20% of those patients actually live out of the country. So it's very, very easy to work together. When we have to have a face-to-face once a year. That's really the law, that we just face-to-face once a year. And I think it's changing. We can even do video face-to-face these days. That's sort of a gray area. If we're going to do procedures like shockwave, platelet-rich plasma, obviously I have to have you in town. The way the shockwave works is it's a 3-week, 2 treatments a week times 3 weeks, then a 3-week or more break with another 2 treatments a week for 3 weeks. I've done it also where guys have flown in and we've done 5 days or 6 days in a row. We've tried it in different ways. The jury's still out, but all of the studies were based upon 2 a week for 3 weeks, 3-week break, 2 more a week for 3 weeks. If somebody is having pellet therapy, then obviously I need to see them every 3 to 4 months. But there are some nice accommodations here that aren't really expensive. We help guys all the time, try to find ways to be here and to get some things done. But once I get you started and we're not doing procedures any longer, the procedures are usually part of a fast track on how to get better because they're regenerative, which means they're reversing the cellular change that's occurred. And so it's usually an in-person. But otherwise, phone call, we get you what you need. We work with Empower Pharmacy out of Houston, which is a great high-quality pharmacy, and they ship to every state, I believe. I'm pretty sure we're 50 states now. I haven't had any problems with them, so it's pretty easy to do.
Good. Well, I really want to thank you for your time.
Thank you.
You're probably the first physician I've interviewed that really treats things comprehensively. I'm actually looking forward to seeing you as a patient because I'm curious. I do everything I can to stay healthy and obviously be a role model for all the other guys out there. But there's a lot of testing that I have not done. I'm very concerned. I'm 59 and concerned about my cardiovascular system. As you well know, I've been on testosterone for 7 years.
Yeah.
So, monitoring and obviously doing it safely, but there are changes in somebody's heart and vascular system that I really, beyond a stress test, I want to do more than. I just went to a cardiologist just to get a workup, and it was basically a EKG, a stress test, and a CT, which is, like you said, that gives you some information, but not the entire picture. So, and I did a calcium scan, calcium score too.
Oh, good. I'm glad.
Yeah, but I'm at 100, so I'm not very happy. So that's why I'm like, oh, it's time to do something else. So so I'm looking forward to it, and I'll write in this video. I'm going to post it on YouTube, and on the description section, include your website on how to get a hold of you. And hopefully we can do at least 2 more on different subjects like PRP or shockwave therapy and other. I mean, there's so much I can talk to you about
There
for
is
hours.
so much. Yeah,
All right.
yeah, and I love to talk about it. So thanks again, Nelson. I
Thanks
appreciate
a
it.
lot. I appreciate your time, and I'll talk to you soon. Okay. Take care.
Bye-bye.
Bye bye.